My name is Tom Buchholz. I'm the Medical Director of Scripps MD Anderson Cancer Center, and I'm a Professor Emeritus of Radiation Oncology at the University of Texas MD Anderson Cancer Center. Radiation treatments for breast cancer, fortunately, are quite safe and effective. There are some inherent side effects that develop during the treatment course. Most patients who receive radiation treatments over their course of treatment will experience some degree of minor fatigue. This is particularly more pronounced if they're working 40 to 60-hour work weeks in addition and caring for their kids at home. And it's not atypical towards the end of the week to feel somewhat run down. This is very self-limiting and more of a nuisance than a problem. People carry on their normal life during the course of radiation. They could continue to eat normally, exercise normally. You could continue your daily habits without much in way of interruptions. But fatigue certainly is one possibility. The second common reaction is to have some local skin irritation at the site where the radiation goes. So following breast conservation or even after mastectomy, radiation is going to lead to some reddening of the skin, some dryness of the skin. It might become itchy for a little while. And also it could mimic like a mild sunburn. There are instances when the skin reaction becomes much worse. For example, a condition called inflammatory breast cancer, where the skin is one of the important targets, the radiation dose to the skin is going to be much higher, and the skin reaction can actually become quite painful. You could have some breakdown of the skin. But for most patients treated with breast conservation, this would be a highly unusual, severe type of skin reaction. In the past, if you consider your great-grandmother's treatments, we didn't have the same technology that we do currently, and the skin reactions tended to be much worse. Even if the skin reaction's problematic, it always gets better. And it takes about 2 to 3 weeks after treatments before the redness of the skin becomes more like a tan, and then over the next month or two, again, gets back to completely normal in appearance. Longer term, the most significant risks associated with breast cancer radiation treatments, again, have to do just with the breast itself. Sometimes there can be a small shrinking of the breast. It might become more uplifted or youthful, but that could cause some asymmetry. So again, the combinations of both the surgical technique and the radiation can change the cosmetic appearance of the breast. Is probably the most common potential long-term side effect. When we treat lymph nodes, which are indicated for some patients with positive lymph nodes, again, the combination of surgery and radiation can place some patients at risk for the development of arm swelling, a condition called lymphedema. That can be on the range of 5% risk up to 15 to 20% risk, depending on the circumstances necessary and the aggressiveness of treatment directed to the lymph nodes. And finally, patients are concerned about the potential injury to the heart, which sits right below the left breast, and of course the lung, which sits right below both the breasts. Fortunately, with modern techniques, I think we've been able to overcome most of the historical risks that have been associated with radiation treatments injuring the heart or the lungs. With modern techniques, we could actually displace the heart from the left breast by using a technique called deep inspiratory breath hold. Because as we take a deep breath and sequence the radiation just to the period where the diaphragm has pulled the heart away from the left breast, we get a differentiation where the heart is completely outside of the radiation field. So these are important techniques, and it's important that patients receive really state-of-the-art care to minimize or completely avoid the risk of getting a serious injury from the radiation treatments.